different contraceptive methods can be divided really into two groups. One is a barrier that prevents the sperm and the egg getting together, and the other ones are where we use chemicals to prevent either the egg being produced, to alter the lining of the womb, or even block the cervical mucus at the neck of the womb so the sperm can't swim through. Combined hormonal contraception is one of the ones that we use quite a lot, and this consists of either the combined contraceptive pill, which is a packet where you have 21 tablets in and you take them for 3 weeks, the patch, which is a pink patch that you apply once a week, or the vaginal ring, which you insert in the vagina and put that in for 3 weeks and then take out for a week. During the week's break from any of these methods, you will then have a lighter and less painful period than normal. If you miss pills or don't apply patches or the vaginal ring falls out, then the contraceptive effect of this method may be lost. You can miss one pill and we don't have to do anything else as long as that's the only pill you miss in the packet. Your patch can stay off for 48 hours and we don't have to do anything about that. But if it is longer than that, or the ring has been out for more than 48 hours, then you may need emergency contraception and you would need to contact either your GP surgery or the contraceptive clinic. The advantage of the pill, apart from making your periods lighter and less painful than normal, is it also prevents cancer of the womb and the ovaries. There is a slight increased risk of clots in the leg related to the combined hormonal contraception, something called deep vein thrombosis. And if you've had this before or a family member have had this before, then this method may not be suitable for you. There is also a slight increased risk of breast cancer and cervical cancer in ladies using this method, but this seems reversible once you stop that method. These methods work by stopping the egg being produced. They alter the lining of the womb so it becomes thin and then would stop any eggs that may have been produced attaching themselves to this, and it also increases the cervical mucus plug. Another method that we have on offer is the implant. This is a small rod that is inserted in your arm using a little bit of local anaesthetic. It can be inserted within 10 minutes and the most painful bit is having the anaesthetic. After that, it is fine. This is one of the most reliable forms of contraception we have and has a failure rate less than 1%. So less than 1 in 100 ladies will get pregnant using this method. It works by switching the ovaries off so they don't produce any eggs and altering the lining of the womb and the cervical mucus plug, very similar to the combined hormonal contraceptive method. This has to be fitted by a health professional, be that at your GP surgery or as a contraceptive clinic. Once it is fitted, it lasts 3 years. You will be able to feel that it's there, but it's not visible for other people to see that it is there. When it comes to its 3 years, or whether you want to have a child, it is very easy to remove this and requires a little bit of local anaesthetic and a small nick in the arm to take it out. The biggest disadvantage of the implant is the bleeding pattern. And if I had 5 ladies who had an implant fitted, 1 lady would have no bleeding at all, but the other 4 out of those 5 ladies would have some kind of bleeding pattern. This might be nice and regular, this might be once every blue moon, but unfortunately there is no way that we have of predicting what pattern that will be. There are some ladies that do find they get increased acne with this method also. Once we remove the implant, your fertility will return straight away. Another method that we have is the injection. The commonest injection we use lasts 12 weeks, but there are 2 other injections that we use. One lasts 8 weeks and one lasts 13 weeks. Again, this is a very reliable form of contraception and has a failure rate less than 1 in 100. So less than 1 in 100 ladies using this method will get pregnant with it. It requires an injection in your bottom on a regular basis, and you require to attend your GP surgery or your contraceptive clinic for this. To start off with, the bleeding can be very irregular with this, but usually after 3 or 4 injections, your periods will be completely switched off by this and you will not have any periods. If you find this something that you would be struggling to live with, then this method is not for you. The other disadvantage of the injection is it can take up to 12 months for it to get out of your system. So if you were planning on spacing your family or getting pregnant in the next 12 months, this probably isn't the method for you. Another method we have is the progesterone-only pill. This just contains one hormone, progesterone. Progesterone-only pills are pills that you take the same time every day, continuously, so day in, day out. This works by altering the lining of the womb so that any eggs that may have been fertilised can't implant, but it also works by increasing the mucousy plug that sits at the neck of the womb, preventing sperm from swimming through it. The bleeding pattern with the progesterone-only pill can be very variable. Some ladies will have no periods at all on it. Some ladies will have regular periods, and some ladies will have irregular bleeding. And unfortunately, there's no way to predict this. We would just have to see how you went on with it. There are some medications that interact with this and make it not work. So it is important that if you are getting this from a contraceptive clinic, you do tell your GP when you're seeing them so they can make sure they don't prescribe anything that may make this not work. Another form of contraception is the coil or the IUD. This is basically a little bit of plastic and copper that we would fit inside the womb. It does have to be fitted by a health professional, but doesn't contain any form of hormone if you wanted something that didn't have any hormone in it. It is fitted inside the womb. The copper on the coil works by killing the sperm and also preventing implantation of any eggs and sperm that may have got together by altering the lining of the womb. The disadvantage of the coil is it can make your periods a little bit heavier and longer. As far as fitting it is concerned, it's very similar to having a smear taken and probably would take about half an hour to be fitted. It lasts between 5 and 10 years depending on which coil we fit, and as soon as we remove it, your fertility will return back to normal. If the copper coil is fitted over the age of 40, then this will last you then until the menopause and you don't need to do anything else for contraception. The IUS, or the Mirena coil, is a coil that contains progesterone hormone and still a very similar size to the normal coil and is fitted in exactly the same way. The coil contains the progesterone hormone and this alters the lining of the womb to make the periods either very light or not at all. It is as effective as the copper coil and has a failure rate less than 1%, so less than 1 in 100 ladies using this method will get pregnant. The IUS will last 5 years unless you have it fitted over the age of 45, and then this will last you to the menopause. Barriers are also an option to you, but they are less reliable as often they interfere with the act of sexual intercourse, and they are working by preventing the sperm and the egg getting together. The commonest barrier we have is the condom, and it is really important if you do use condoms that you make sure they have a kite mark on them. There are also femidoms which are available, which are the female condom, and then we have diaphragms and caps. These also need to be fitted by a specialist person. A diaphragm is slightly larger, the cap is slightly smaller. Both of these are fitted to prevent the sperm actually getting into the womb. Their failure rates can be anywhere up to 15%, and so out of 100 ladies using this, 15 will get pregnant using barrier methods. If you want something more permanent and irreversible, then sterilisation is an option. Male sterilisation has a failure rate of 1 in 2,000 and is done under local anaesthetic. And the tube taking the sperm from the testes out is cut and a little sample taken. It is really important if you use this method as a form of contraception that you wait to have 2 negative samples after this has been done before this method has been declared successful. For female sterilisation, the failure rate is 1 in 200, which is very similar to some of the long-acting reversible methods that we have, like the IUD, the IUS or the implant. So you may want to consider one of these instead, as female sterilisation tends to involve a general anaesthetic. This works by blocking the tubes, and so the egg can't get from the ovaries to the womb. Don't forget, there is also emergency hormonal contraception if an accident happens with your method of contraception or you have some unprotected sexual intercourse. There are 3 different ways that you can have emergency contraception. 2 of them involve taking hormonal tablets, and the third is having a coil fitted. There are 2 different types of hormonal tablets. One is called Hormonal, which is a tablet you take within 72 hours of having unprotected sexual intercourse. We know this method works better the sooner you take it from the episode of unprotected sexual intercourse. It is available from GPs, contraceptive clinics and also some pharmacists. LO1 is another form of emergency contraception, and this can be taken within 5 days of unprotected sexual intercourse, but is only available on prescription, so would be only available via your GP or a contraceptive clinic. The final and most reliable method of emergency contraception is the emergency coil, and this can be fitted within 5 days of unprotected sexual intercourse, or within 5 days of when we estimate that you may have ovulated. This would require you to see a health professional that can fit this, and this may be your GP or may be the contraceptive clinic.